Hi, I'm David Watson. I am a physician surveyor for the Joint Commission. I currently live in Texas and work for the Joint Commission surveying hospitals for accreditation 1 week every month. The Joint Commission is the accrediting body that goes around every 3 years and looks at hospitals to make sure that they meet certain standards of care and that they are able to demonstrate those as we walk through the facility and look at the way they take care of infection, the way that they prepare food, the way that they write orders and things in the chart. And then we have an engineer who checks out the engineering of the facility. The standards all started many, many years ago, back at the turn of the last century, when the American College of Surgeons decided that hospitals needed to have quality done in the same way at each hospital. And so that is how the Joint Commission started. It eventually became a collaboration of several organizations in about 1960, with the hope that we could give the same quality care to all patients who received it in the United States. Well, safety is the foundation of good health care. It is all done, right now the Joint Commission has adopted a new motto, and that is zero harm. So our goal is to work towards that, and all the safety measures help us reinforce those things. For a long time we thought that we couldn't adapt things that they do in industry, but we found that those highly reliable processes work very well in medicine, eliminating things that are infections on a recurring basis. We know if we take certain steps we can prevent those, and just looking at safety overall, making sure that the sterilization process in the operating room is done properly, that they go through those steps, that scopes that are used for doing endoscopies, that those are cleaned properly. Those are all safety things that are very important, and we've heard the stories where they aren't carried out properly. The Las Vegas endoscopy clinic, for example, with all the problems that they had there. So someone needs to be making sure that that happens, and we are one of many bodies, but the largest by far, of the hospitals that we survey and take care of, and I really enjoy being part of that process. It's one of the things that I always say to hospitals when I survey. The words I don't want to hear is, "We prepared for the Joint Commission." I'm here to look at you at a point in time, and hopefully that allows us to come and just be another set of eyes and have the opportunity to look at what you're doing. If you don't meet the standard, we're going to explain why and give you some options to help you. If you exceed it and have some really great things, I'm going to look for those too, because I want to take those back. I have this philosophy about medicine that there are no good secrets in medicine. People need to share the good stuff. This is not like, inventions. These are things that have to do with the well-being of all mankind, so we should share them. Well, I think policies are drafted to make sure that we have a coordinated, consistent way of doing things. They are the framework by which we can have all employees do the same things for the same purpose. And that's one of the things we look for in the Joint Commission. When there are things that we look at that we are concerned about, we want to make sure that what the organization does agrees with the policy that they've written. And that's a very intricate part of the everyday survey. There is a concept out there as far as safety goes, and the concept basically is called collective mindfulness, which means that every person in the hospital is a safety officer. So if you're walking down the hall and you see something on a tile that doesn't look right, you pick up the phone and you call the people in maintenance and say, "Hey, the tile outside of room 247 is stained and there may be something going on. Come take a look at it." Or if things are dirty, or if something is broken, or something is outdated, it's everybody's responsibility to take measures to make sure that that's corrected. One of the other things that I like to see is, I used to do interventional blocks. I like to see the gown in the operating room tagged in such a way that not only do I know that it was inspected, but I know that it was inspected within the last year. I don't just look for the number, but a color code that says when I pick that gown up and put it on to protect myself from the radiation, I know that it was checked, and I know that I'm doing it not because there's a policy that says I should do it, but also because I know it's going to protect me. It's an idea of what is called a just culture, and what that means is that we adopt the ability as an organization to look at things that happen as learning opportunities rather than opportunities to punish. So we are open to look at those things that don't go right, to figure out why they don't go right. And as I said a little bit in my talk, I pointed out even when these adverse events happen, 85% of the time, they don't involve a medical error. And even when a medical error happens, over 90% of that time it has to do with the system, that the system has not organized itself in a way to prevent people from being put in that position. So that pretty much sums up why we need to look at this overall structure and say, hey, these are opportunities to learn, not to punish. Okay, this happened, but why did it happen? Did that person do it intentionally? I don't think so. Okay, was she trained properly? No. Is that a systems issue? Absolutely. That goes right back to leadership. It goes back to the immediate supervisor. It goes back to one of the things that we look at. We always look at competency for people to see if they've been trained and if they've checked off on that every year and that they've still kept that competency level. So she probably hadn't even been given the ability to have the competency to begin with. So ultimately, the responsibility for what happened to her lies with leadership. And that's the way I would look at it. That's the way I would look at it if I were doing a survey. Well, it's that balance between what you feel and what you know. And if you can apply that in the sense that it gives you that feeling that what you're doing is right, for me it would be almost like that second voice of reassurance that you're on the right track. I think there are great opportunities out there for the use of the advancements in technology. We've seen so many things come. I was blessed to start in anesthesia back in the 1970s where everything was manual. I pumped up the blood pressure cuff, I listened to the heart, I felt the pulse, I looked in a patient's eyes. This is all done by machines now, and the microchip has come a long ways. But other things that are coming in the future I think will even be far more changing. We have the capability now of putting a little dot like a Band-Aid on your wrist, and it can read your pulse, your temperature. It can even, by impedance, tell what your blood pressure is. Now a nurse 50 miles away, if she has a television, is able to Skype. She can take that information, look at you on there, and decide whether she needs to come out to your house today or not. So this will allow, I think, healthcare to become more efficient and hopefully less costly. I think the excitement for me is the possibility of leaving medicine better than I found it. I started medicine in the 70s when things were rather crude compared to what today is. But along that way, I've learned lots of things, and hopefully I can share those with others in their journey to make medicine better. It's always that pursuit of excellence, that wanting to reach a little bit higher, to do it a little bit better. And always with the goal in mind that we're taking care of patients and we never want to harm them. I think the empathy, for me, the important part of this conference is what I talked about, and that's second victim. And these are healthcare workers that are involved in an adverse event. And the empathy that needs to be expressed to them is that connection of realizing that they've been in a difficult situation and they need to be supported and they need to be reassured and they need to know that they went into medicine for the right reasons. They take care of patients because they love what they do, and they should continue to have that fire in their eye when they go to work every day, to be totally engaged. We know that total engagement leads to less errors, so we want our workforce to be engaged. This has been a fabulous opportunity to meet with other people who are concerned about the welfare of patients and about the welfare of their fellow healthcare workers, an aspect that is often overlooked. We take great care of patients. We don't always take the best care of ourselves.